Hi, Helen. It's good to
Hi,
see you.
hi, Susie. Nice to
I'm
see
just
you.
going to introduce briefly what this interview is about. Um, Helen had a full hip replacement a while ago, and as an exercise referral specialist, I was one of the people who helped her with some of the treatment through that. So we just wanted to go into a little bit more detail about how these things happen, what other treatments she experienced along the way, and how it's affected her. So I'm going to try and just pass it over to Helen now. Then my first question is, how was the hip issue first diagnosed, and what were those first treatment recommendations?
Okay, well, I suppose it was a slight self-diagnosis, and it was pain, in the hip, and I was finding it difficult with exercise, particularly walking and things like that. So it was confirmed that there was a deterioration in my hip through going to have an X-ray, really. But at the same time, I was wanting to try to keep moving. So tried lots of different things to sort of ease, started using poles when I'm walking. But I was really keen to try to keep exercising. So as you know, I sort of consulted you to see, because I was already doing and enjoying Pilates. So sort of looking at different exercises and things that might sort of ease it. And I found actually going and doing my Pilates regularly that it would just generally free up my hips and the movement would get better, you know. So well, obviously, things get better. So you just sort of keep going with that. And then as things sort of started to deteriorate, I had to look at sort of getting some pain management, but I was really reluctant to, get onto medication. So it was just trying to pursue different exercises to sort of help the kind of muscles to free up the hip movement was very much, what it was
You,
about.
I know that you have been very proactive about how you've looked after this condition. So, what other treatments did you experience along the way before the surgery?
So I was keeping up sort of with my Pilates, and also occasionally when things started to get bad, quite with the pain, I went to see a physiotherapist, and I found that that was really, really good. So I was getting exercises that were very specific to increase the range of movement that I had to try and improve the sort of hip movement, also strengthen the muscles around the hips. Uh, Actually, the pain I was getting was more in my knee, strangely. It wasn't really, my hip when I was walking, it was the knees. And what I found in looking back and consulting with her, basically I was going annually. So I would go and she would give me exercise and I would be doing these. And it kind of lasted kind of about a year. And it fetched up every sort of October, because in the summer, as you know, I would going sailing and I was doing, a lot of work in the boats. I'd come back and sometimes it deteriorated. So that happened, I think, for about 3 years, really. So I'd say with doing that, I managed the pain and I didn't get to the point where I was actually needing surgery. Um, with me, what happened with needing surgery was I kind of all of a sudden had experienced acute pain. Up to that point, it was difficulty walking. I could maybe take some painkillers, but this, I got to the point, it was just so bad. I couldn't sit, I couldn't sleep. And it just happened virtually overnight, the acute pain.
I
And
think
then
that
I had
must
to get,
sort
to get
of
on to, actual pain meds.
yeah, I think that must have been quite an alarming time to have such a fast decline with it.
Yes, it was. And at that point, I realized, I really, really needed to, do something about surgery, really.
And do you think that because you had been doing the Pilates for so long and seeing the physiotherapist regularly, if not a lot, you didn't have to see her a lot, but you saw her regularly enough. Do you think that that helped delay that decline?
Very much so. Very much so. I think I'd have been, in surgery, much earlier. And I think if you were waiting for surgery, I think that would help you to manage your condition, because I think it's really important that you try to manage it and manage the pain at the same time to try to keep yourself moving as best you can. I think the thing is to try to keep up your flexibility and movement, no matter how little the movement is, even if you've got to the point where you're actually stuck in a chair. I think there are things that you can be doing. And I think it was really important, having had the surgery, I think it is important to be, and it sounds strange, but to be as fit as you can before you get to the surgery, and be as flexible as you can and moving as much as you can before you get to it. And then the follow-up after surgery is, yes, it's major surgery, but it's what you do afterwards in terms of exercising and movement. I think it'll provide you with the greatest success and, return to normal life, really.
Fantastic. Yeah. I mean, I've helped a lot of clients through joint replacement, and that's always the response. The better prepared you are, the faster you'll recover, and the better organized you'll be with your recovery. So I think it would be really, really interesting for everybody to know what you're about to do now in the next.
What am I about to do now? Oh, well, in a week's time, I'm going back to sail. We have a large 40-odd foot sailing boat in the Baltic, and just go and spend the summer sailing around. So it's very physical, and it's up and down, ladders all the time, hauling on ropes, climbing on board, jumping off to tie up in these crazy systems that they have. So yeah, it's, you've got to be kind of fit and flexible to do it. And I celebrated my 70th birthday, so I realized, this is all time dependent, and being able to continue sailing. So it's, trying to keep fit and flexible. So I also aim to try to do my Pilates while I'm on board. So that'll be kind of interesting.
Well, I can't wait for you to join us online on board. I'm really looking forward to that. It's going to be an experience for us all.
Yes, it'll be kind of fun.
Thank you very much for your time today, Helen. That was really interesting hearing your story.
Okay, thank you.
Thanks.
Bye.
Bye.